Good morning, everybody. My name is Yanish, and I come from a north western part of the country, which is Amritsar. And today I'm going to share my experience with acupuncture, what I have learned about acupuncture, and what can we do to treat this condition, which is called as trigeminal neuralgia. Now, this is a very devastating condition. In this, patient generally has very severe, very severe attacks of pain, which are intermittent, which are very severe. Which are very severe. Patients tend to commit suicide because they are either not diagnosed or not left with any other option because of the severe pain. Let's see a little bit about anatomy of. So, I'm going to speak about a little bit of anatomy of trigeminal neuralgia. Now, this is the trigeminal nerve. It has three portions: the V1 division, the V2 division, and the V3 division. So, these three form into one nerve at the Gasserian ganglion, which carries from where the trigeminal nerve becomes one nerve and then goes into the brainstem, and then there are other motor nuclei. So, trigeminal neuralgia is a problem of this portion of the brain. What happens, I will explain later, but then these are three nerves which form one nerve into a ganglion and then nerves, and this enters the brainstem. So, this is the basic anatomy of trigeminal neuralgia. So, what are the symptoms? Patients are extremely distressed. They have pain which is extremely severe, which is intermittent, which is sharp, shock-like, and which is aggravated by even daily activities like brushing, washing their face, drinking, eating. They cannot drive because of air touching their face, which triggers attacks of severe pain. And you will see patients coming to your clinic or to your office, and they will suddenly stop speaking and they will say, I have severe pain, and then they will stop responding for a while, and then the pain is gone. So, this is a typical history of trigeminal neuralgia. These patients have very severe pain which is absent at night. That's typical of trigeminal neuralgia. This pain responds to medicines which are nerve stabilizers such as carbamazepine, and that also helps you to diagnose this pain from other types of pain. Patient generally tends to be very distressed, depressed with his pain, and often has visited dentists who may have extracted some teeth. The dentists are also becoming more. They are also learning to diagnose trigeminal neuralgia at the peripheral level now, and we see patients whose teeth are removed less often nowadays, since past about 5 years or so. So, as I said you, the problem is within the brain. In trigeminal neuralgia, there is this piece of blood vessel, this part of blood vessel, which is pressing on the trigeminal nerve, which is coming out of the brainstem and going into this canal over here. So, the problem is within the brain, the manifestation is at the face. So, why this happens, I will explain you in the pathogenesis, but the origin of the problem is within the brain, inside the brain. So, how does this pain happen? So, this side is the face and this side is the brain. Now, this is a touch fiber which carries touch sensations from the face to the brain through the trigeminal nerve. This is a pain fiber which carries pain sensations from the face to the brain through the trigeminal nerve. As I showed you the blood vessel in the previous slide, this blood vessel, because of its continuous pulsating action, it presses on the nerve for months and years, and slowly the nerve demyelinates. Demyelination is similar to the plastic which is seen on the wires. Any wire has a plastic on the top. If you take off the plastic, the wire is liable to short circuit. So, the same thing happens. This blood vessel continuously pulsates and removes the plastic covering of the nerves. In this case is the trigeminal nerve, and that results in short circuiting of the signals. So as I told you, the sensation, any kind of sensation, touch sensation, feeling of wind on the air, brushing, eating, all of these are touch sensations. So what happens in trigeminal neuralgia? Touch sensations, because of the demyelination, they travel from the face, and then because of this short circuit, start traveling into the pain fibers, and then the brain perceives that the pain has come from the face. Because of this short circuit, brain perceives touch sensation as a pain sensation. So this is the basis of trigeminal neuralgia, which everybody must understand. Now let's come to how can we treat trigeminal neuralgia. So pain is a very big topic in itself. How brain perceives pain and the gate control theory and how the gate opens, and there are many things about pain. But let's stick to the topic of today, which is trigeminal neuralgia and how can we treat it. As I told you, the problem is within the brain over here, from the ganglion to the brainstem. Somewhere during that path of the nerve, there is a short circuit, and that short circuit produces severe pain because of the touch sensation, which is perceived as pain by the brain. So what can you do to prevent this thing? Either you destroy the nerve over here by chemical neurectomy or by surgical neurectomy. You cut the nerve so that no sensation goes from the brain, no sensation of touch goes from the face to the brain, and so no pain sensation is perceived by the brain. But the problem is that whatever you do, the nerve tends to regrow, and it tends to regrow in a matter of 6 months to a year. So you can do various things. You can either cut the nerve or do some injection in the nerve, like alcohol injection. So what else you can do? You instead, if patient has pain over here and pain over here and pain over here, in all the 3 divisions, obviously you cannot cut all the nerves, because these nerves are also important to carry, the most important function is to carry the touch sensation from the cornea to the brain. If you cut the V1 division as a whole, then the patients are likely to develop corneal ulcers and then blindness. So you cannot cut all the nerves. So there are alternatives. What you can do is you can put a glycerol injection, which will damage the whole ganglion itself, or you can burn this ganglion partially or stun this ganglion by radio frequency, or you can compress on this ganglion and then make this ganglion function to come down for a while. Then there are treatments which are directed to the root cause. One of them is radiosurgery, in which we burn the nerve in this portion, but the corrective treatment of this problem is to remove the short circuit. So if there is a blood vessel, there is a nerve, and the blood vessel is pressing on the nerve and producing a disease of the nerve, the idea is to separate them so that the disease goes away, and that is called microvascular decompression. Now finally, and then I will speak about acupuncture. I have kept it in the last so that you tend to understand what happens with acupuncture. So these are the treatment options, from peripheral to ganglion to central, and then the acupuncture. So generally the first line of treatment is medical. Patients have either gone to dentist or gone to a neurologist or a neurosurgeon or a neurophysician or a psychiatrist or a general physician and would have consumed one of these drugs. These drugs are quite efficacious. They work for many, many years, but gradually. The second step is to destroy the nerve peripherally. As I told you, you can do either surgery, cut the nerve, block the nerve, put some bone wax on the nerve so that it doesn't recover, or you inject some alcohol, like it is happening over here. or you destroy the nerve inside the brain by putting some glycerol, by making the nerve hot for a while so that it does a controlled damage, or you press on the nerve and then reduce the function of the nerve for a while, or you do a radiosurgery. Radiosurgery is nothing but a very, very sharp focal radiation dose to a particular point in the brain so that the nerve does not, the nerve function reduces for a while. Then you have these glycerol injections which are done under fluoroscopic guidance to inside the ganglion, and then this reduces the pain for say few months to few years. Then this is what I spoke about radiosurgery, where you give focused radiation to a particular point at one place inside the brain so that it destroys that area of the brain in a controlled fashion, which is the trigeminal nerve in this case. So this is what is the what is the microvascular decompression of the trigeminal neuralgia. You can see that this is the nerve which is coming out of the brainstem and going towards the brain. This is the blood vessel which is compressing on this artery, and this is the either the muscle or a pad which we place, or a Teflon pad which we place in between them, and it stays there for the life. So it cures the problem for life. So this is the gold standard or the best treatment for trigeminal neuralgia. Now there are many patients who have undergone various procedures, whose disease has lasted say 10 years, and it has either not been diagnosed or poorly treated, or has been treated. So there are many patients who have received many treatments and they have not got a result. So in these cases, microvascular decompression is probably not the best solution. So let's come to the acupuncture principles. It is based on combining ashi and distal local points. So you have to combine local and distal points in order to get the best benefit out of this, to get the maximum pain relief. Selection of the points depends on the nerve affected. I have a slide. I'll show you which trigeminal nerve is affected, and then what points to be used. For patients who have very severe pain, the number of points used are more, and then for patients who have extremely severe pain, you have to extend the acupuncture sessions to 30 to 45 minutes or sometimes an hour. For patients who do not get relief with simple measures, manipulation every 10 minutes extends the benefit and improves the outcomes. For patients who have severe pain despite acupuncture, use of pressed needles in the faciomandibular area are also beneficial as a reinforcement. Sometimes when patient does not allow you to needle on the same side, the opposite side can be needled, because the side of therapy does not matter according to the acupuncture principles. A little paresthesia can happen. If that happens, you consider it as a good sign that probably you have achieved what you wanted to achieve. So as you can see, in all patients, DU20 point is used. For other divisions, the different points are used, which include local points and distal points. Now, with experience, you gradually learn that the more distal point, the lesser the distal points are as beneficial as the local points, but you have to be persistent, and then only the results will happen. In many cases, the results do not happen immediately. It takes 5 to 7 days for the results to start. So this is one of the cases which were one of the first cases treated by the needle through technique at the Vadapalani clinic, Bliss Medicare Center in Chennai, with Dr. Rajesh Verma. This patient had received all kinds of treatment except for microvascular decompression, was a high risk for brain surgery, did not in fact want a brain surgery, and she wanted an acupuncture alternative treatment. So she was on high dose of medication, which was not settling down with the drugs. She received, from 7th session onwards, her pain started to reduce. From 15th session onwards, her pain reduced significantly, and by 30 days, her drugs had come down to 1/4 of what it was. So initially, what we did for this, we initially did distal points, and then we did needling through technique from ST4 to ST6. So the diagnosis of traditional Chinese medicine were liver fire, liver and gallbladder damp heat. So her condition improved significantly after 15 sessions, and she was relieved of pain. I would say that acupuncture, we are also in a learning stage of how acupuncture works in trigeminal neuralgia. Probably it makes the brain relearn the way in which it perceives the pain by manipulation of energies and the manipulation of pain pathways, which reorganizes after many years of patients having trigeminal neuralgia. I would say that out of all these therapies, acupuncture is quite inexpensive. However, the patients need to have time to come to your clinic, say 5 times a week, and then the patients have to be motivated enough to take this therapy, which can be used either alone or as an add-on. If I can conclude, in case there are any questions, I'll be happy to answer.
Only 1 or 2 questions can be allowed. Is there any question from the audience?
The acupuncture, if you are doing on the same side, is it going to produce the same phenomena which is creating this pain? Because you are just touching the surface, or you are just puncturing on the same side. So does it aggravate the symptoms, or you should try on the opposite side? What is your experience with this patient?
Well, there were a couple of patients who were unwilling for anything to be done on the same side. So in these patients, the science of acupuncture is entirely different from what we know from our traditional English medicine or a conventional medicine. So when we do the acupuncture points from the opposite side, we found that the results were good, not to begin with, but the results were slow to start, and within 10 days the patient started having pain relief. The reasons for that I cannot explain you from the medical point of view, because the pain pathway in acupuncture is managed in an entirely different way from the way in which we understand from the modern medicine. So the opposite side also does work. There are patients who are extremely scared for anything to be done on the same side. Even they cannot brush, they cannot eat, they cannot wash their face. They tend to have poor orodental hygiene because they cannot clean up their face from inside or from outside. So you tend to have patients who clean only on the side of the face which is unaffected. So they are very apprehensive for anything to be done on the disease side. So these are the ones whom you would try to do acupuncture on the opposite side first, gain their confidence, get them some pain relief, and then do it on the side of the pain.
Any more question? Only 1 question will be allowed. Any more questions? I think there's no more question. So we thank Dr. Bhanot for a nice presentation. And it's a major problem, we know, to all the acupuncturists we are treating with. Yes, we do prick on the same side. Doctor, for you, yes, we also prick on the same side. And we get results. But it should be mild.
As far as the experience is concerned, patient says that there is many times, if you compare the two, I'm just asking the question, what is it?
Yeah, that's okay.
Yes, it's a aggravation of the symptoms patient mostly tells after if you are puncturing the same side. But if you start with the other side, the patient is more comfortable. This is an experience of me.
Yeah, that is what he said.
That's why I told you.
It's okay. We avoid generally the electrostimulation because it stimulates more. Yeah. It's okay. So we thank you, Dr. Bhanot.
Thank you, Dr. Bhanot. May I request the chairpersons to give away the trophy to the speaker?